Thanks for staying with us on The Real Story. Governor Lamont recently announced a Screen and Stay initiative for Connecticut schools. It allows students and staff who are identified as coming into close contact with someone who is positive with COVID-19 to remain in school if they were wearing masks and don't develop any symptoms. Now, there are exceptions to this in different specific scenarios that either support the Screen and Stay approach or don't. Now, there is one scenario that State Representative Greg Howard thinks should be included: close contact in a cafeteria setting for students. He says that parents are frustrated that their children continue to be quarantined when he says data doesn't support the child staying home. So we want to talk with him right now about it, and we're bringing on State Senator Saud Anwar, who's also a doctor, to talk about those COVID numbers that we're seeing tick up. Good morning to both of you.
Good morning.
All right, Representative Howard, I want to start with you. You were pleased that this Screen and Stay policy was implemented in our schools. Talk about that and why you think it should be expanded.
Thank you very much. Yes, I was pleased. So as school started going on and I started getting a lot of phone calls and emails and just interactions with parents, one of the things I do in town is run a youth football program. So I have occasion to speak to a lot of parents, by incidentally often, was that their kids are being quarantined. I had a fourth grader in one of my towns who was quarantined 3 times for 10 days at a time. So I started poking around to similar states to us. And what I mean is states with similar COVID numbers, as far as vaccination rates and infection rates, et cetera. And I went to our neighboring Massachusetts and found that their test and stay model that they had implemented back on August 30th when they started school had been very successful. And so I got those numbers. I had conversations with representatives from their Department of Education, Department of Public Health, and got a good grip of that. And to see our state move to a similar thing, obviously being screened rather than test for reasons that the Commissioner of Public Health outlined, which make perfect sense to me, was a great step in the right direction. Because if I had lost 2,000 days of in-person learning cumulatively over 2 towns in one House district, the number across the state had to be, significantly larger. So when that rolled out, I was excited. I thought it was a great win for our students and for our working families because, while the focus is certainly on keeping kids in school, we cannot ignore the fact that when an elementary school kid comes home for 10 days, that the parents have to working families have to make some arrangements. So that was the thing that I got excited about. But I did notice that that the Screen and Stay model, or the option of Screen and Stay, was not afforded to students who had contacts in a cafeteria. And I heard from my local officials that is a pretty significant number of kids because of the way they move about the school, and you can't keep 6 feet. And I should say the cafeteria isn't excluded, except that if they can't keep 6 feet, which is pretty unreasonable in most school settings. So I went back to Massachusetts and I confirmed through them that to date, they have had no minimum distance requirement for their students in the cafeteria or in the classroom. So while a logical person could understand and say, okay, if kids are sitting next to each other and they're putting things in their mouths, they're more likely to get a transmission of a virus. However, the Massachusetts data, as of October 31st, they have, in their test and stay model, they have conducted over 86,000 tests of kids who have been identified as close contacts in the cafeteria and elsewhere in the school, because they don't differentiate between the two, and have only had just over 700 come back positive of those 86,000 tests. And it's an unknown what percentage of those 700 actually were transmitted in school. So to me, that data,
someone outside.
Correct. So to me, that data supports that there's a very, very, very low transmission rate in school, inclusive of the cafeteria. So my current plea to the Department of Public Health and Department of Education is, while I recognize there is a risk, it's such a low risk in comparison to the lost education and stalled emotional and social development of our children, that perhaps we could take a look at that and extend it to those close contacts as well, to try to keep as many kids in school safely as we can.
State Senator Saud Anwar, I want to bring you in with this as well. I know you know how the state tests here in Connecticut very well. Are we testing? Are schools looking at who is in the cafeteria versus not, or is that just something Massachusetts is doing?
I think we are not doing as much as what Massachusetts is doing, and we are also keeping track of what's happening in our neighboring states and collaborating. The reality is we don't have a textbook for this, and then that's part of the challenge. And we're looking at what are the best practices, and how is the disease progressing? What is the number of new cases that are in a community? And if you can see across the part of our state, the numbers are quite different, unfortunately, and for some places, fortunately, and that's part of our challenge is that we may not necessarily have a universal rule for every school system. But I recognize and respect where Representative Howard is coming from. I think the important thing is that when you have so many students and one gets an infection or is got a close contact, putting everybody through quarantine is a logistical nightmare. And while we have tried our best to be as safe as we can, some of these logistical challenges have become very difficult. And at that time, you start to look at what is the vaccination rates, what are the actual cases that we are seeing in the community, and what are the risks there, and can we mitigate those risks by other means? And that's what led us to come to this screen and stay. I recognize, and I've seen the numbers that Representative Howard is talking about for Massachusetts. I recognize that there was like 0.8% of positivity at that time from the numbers of tests that they were doing. The challenge is since October, the number of cases have increased or have almost close to doubled. And what is the cause of this? We don't have enough data for this, but I think if we are also in our state, we're seeing the numbers are increasing too, Jen, and that's a scary part as well, that we are getting an uptick again. And that's why it's important to make sure that we get enough of the children vaccinated so that the risk decreases further. And as the risk decreases, we will have many more luxuries coming our way, which Representative Howard is also seeking, and so am I.
You know, you both are very interesting because you have jobs that are on the front lines. Representative Howard, you are a police detective in Stonington, and Senator Anwar, you are obviously a doctor, pulmonary doctor, if I recall correctly, which is obviously a big deal during, COVID, obviously a respiratory illness. Representative Howard, we only have like a minute and a half left, but what's your experience been like dealing with COVID on the front lines?
Well, it certainly fails in comparison, I'm sure, to my colleague, Senator Anwar. You know, the police department saw a rapid decline in call volume at the beginning of the pandemic because people were staying in and not really going out at all. We saw a massive decline. And it really wasn't, Jen, until, we sort of got the pandemic, I don't want to say under control, but we got a bit more comfortable as a society. We learned more a little bit about it. We had mitigation procedures in place when the police really were out interacting in large volume. Whereas, in the medical field, they were doing that from day one with a lot of unknowns. So, but what we're seeing now in the police department on the police side is sort of the aftermath of it, right? The rise in mental health issues that we're charged with dealing with, the rise in domestic violence situations, the rise in drug and alcohol addiction that have all coming as a result of pandemic mitigation measures that we're now facing. So I think that is more of an impact. And the other thing is too that police officers, we're used to putting ourselves at risk. That's what we signed up for. That's what we've been doing since the day we put that badge on. So it was just a little bit of a different risk for us, but we continued on it. So that's sort of where it's at now. But again, I would never take away, we talk about people on the front lines. It was the medical professionals that were, treating patients that they didn't know if they were going to, that they were putting their life on the line doing that. So I certainly would not take away from them, Jen.
I know. Senator Anwar, I know you've spoken on this program before about some of your experiences. We are out of time, but can you just tell me really quickly, has it gotten better with the vaccinations? I know we're seeing those numbers tick up, but are you feeling, we're in a very different position than we were at the beginning of the pandemic, obviously.
I'm seeing a little skewed part. The skewed part is that the patients I'm seeing in the intensive care unit, majority of them are unvaccinated. And I wish and pray more people would get vaccinated, protect themselves, protect their loved ones. And again, the vaccines are imperfect, but the disease is terrible. So in that situation, we should try to do best to save and protect ourselves and our loved ones.
Senator Anwar, Representative Howard, thank you both so much for coming on The Real Story and sharing your opinions. All right, that does it for us on The Real Story. If you want to watch these segments again, head to fox61.com or download the Fox 61 app and watch The Real Story every Sunday at 10 a.m. right here on Fox 61. Have a great morning.